Hi, this is Dr. Froy. I want to go over with you some of the diagnostic testing that we use here in the office. This is called an autonomic nervous system testing. You're going to get a full report like this. It'll explain in detail about the autonomic nervous system, and then we run the test on you. The test takes anywhere from 5 to 8 minutes. You sit here quietly, and basically what we're picking up here is heart rate variability through these little calipers here. And a few points that you should understand. The heart rate variability measures your autonomic nervous system. 90% of the output of the brain goes to the autonomic nervous system, and the more varied your heart rate is, the healthier your autonomic nervous system. If you go to PubMed and you type in heart rate variability, you're going to find 22,596 research articles published. So this technology has been used since the early 1960s to measure various health outcomes and parameters. My machine actually gives me 21 different measurements. And when we're all done, I will review these all and we'll have an idea of how your autonomic nervous system is working. But it's a very accurate way to look at the 90% output of the brain. We want to see how this autonomic nervous system is working. The autonomic nervous system runs all your hormones. It runs sex hormones, thyroid, adrenal hormones, all the hormones. It runs the gastrointestinal system. The heart delivers the lungs. It runs the musculoskeletal system. It has a lot to do with your neurotransmitters. Has a lot to do with your stress response, a lot to do with your immune function. So we get a measurement here, and then we can start to objectify what your basic starting point is with your autonomic testing. Thank you. Hi, this is Dr. Froy. I want to go over another piece of equipment called bioimpedance analysis. This is probably one of the newest pieces of equipment that I've gotten into the clinic here to measure function. Everything that we do here is to try to measure how your body's working. We do not depend upon how do you feel only. Of course, we want everyone to feel better as soon as possible, but we also want to be able to measure objectively where was your health, where is your health, and are we moving in the right direction. So body composition prediction using bioimpedance analysis is a key factor for the evaluation of a general health status in humans. There's a tremendous amount of research on this. We're measuring intracellular water, extracellular water, total body water, and we're also getting something called your phase angle. The piece of equipment has been used to measure cancer patients, and they're tracking cancer patients to look at the growth dynamics to differentiate an aggressive cancer cell versus a benign cell. They're using this a lot with breast density to look at younger girls and their risk for breast cancer over time because they don't want to start radiating a young breast. And it's been used since the 1970s, and it has many different uses, and the results are reproducible and rapidly obtained. And mainly, when we give this to you, you're going to get a report, and in that report, there's going to be some key components here. We're going to be measuring your intracellular water. We want to see this, that the higher is better. Extracellular water, less is better. Total body water. And we also want to get something, and probably the most important thing that I look at on here is what's called your phase angle. So this is a sensitive indicator and predictor of total health. Your phase angle measures the strength and resiliency of the cell membrane itself. And 3 major studies released in the last 5 years have shown phase angle to be more accurate and sensitive indicator of long-term prognosis for patients with AIDS, cancer, and kidney disease. A higher number, the better. So you're going to have these sensors here, and you're going to have these sensors here. You sit for a few minutes, and the machine does its running. It will give us the analysis, and we will combine it all together and tell you what it all means and looking at your overall health picture. Thank you. This is Dr. Froy. I want to go over another piece of equipment that we use here to objectively measure your overall health and functional levels. You see this little device here. It's a fancy name. It's called plethysmography, or we call it an angioscan. And basically what this does, it gives us a lot of information on various different components and how your cardiovascular system is working. It is not used to diagnose disease. It's used to measure cardiovascular fitness and overall function, but some of the key areas that you want to know. It's a promising technology due to its simplicity, low cost, and non-invasiveness. It has potential for early screenings for various atherosclerotic, which means heart, pathologies, and could be useful for regular general practitioner type assessments. The clinical applications, it's been used in various different clinical settings, but it can include clinical physiological monitoring of blood oxygen saturation, how much oxygen you have inside your system, heart rate, blood pressure, cardiac output, and respiration. It assesses the vascular system for arterial disease, arterial compliance, and your overall vascular aging. It also looks at your microvascular blood flow and tissue viability. It looks at your autonomic nervous system, which looks at vasomotor function, thermoregulation, which is temperature control, blood pressure, and heart rate variability. It also looks at your orthostatic intolerance. That's the ability of your blood pressure to move up and down as you need it over time. If you're having trouble with that, you could feel weakness or dizziness when you stand up or move around. There's neurological applications and cardiovascular variability assessments. So each of these has a very good clinical use, and over time we will give you a report, and in that report you're going to get a little sheet explaining some of this. But there's 6 different measurements that we get. We get your heart rate, we get your vascular stiffness. We want to see a negative number here. We want to see no vascular stiffness over time. We're also going to get your pulse curve type for your age. We're going to get your vascular aging. What's the aging of your entire cardiovascular system, which has a lot to do with the heart and the brain. Your stress index overall. What's the stress response inside your body? We're going to measure the hypothalamus pituitary adrenal axis through this machine. And then lastly is your oxygen saturation. If we're talking about optimal brain function and optimal health, we want this to be near 99%. So we're going to get all that information, and we'll be able to review this with you and show you how this piece of equipment has demonstrated a good or bad functional outcome. Thank you. Hi, this is Dr. Frawley. Another component that we're going to be measuring is cerebellar testing. The cerebellum is the back and the bottom portion of the brain, and it really is the powerhouse, and everything for the brain is dependent upon a proper cerebellum. So you're going to put your pinkies out like this. You're going to close your eyes, and I'm going to have Larissa, over time, touch the tip here to the tip of her finger here. We're going to test both hands. You can open your eyes and drop your hands down. We're going to have you turning your head, and overall we're going to grade these. And then we'll have a basic idea of how the left cerebellum is working and the right cerebellum. Thank you. Hi, this is Dr. Farley. I just want to go over with you our ETF machine, which is our electronic tuning fork. This is a way to measure peripheral neuropathy. It's an unbelievable piece of equipment. I used to do this by hand, and it would take a long time. This takes minutes, and we can let you know whether you have severe, moderate, mild, or normal nerves. If you have nerve damage, how bad are they? Which hand is it in? Left, right, left leg, right leg. But it's a great way to measure what's going on, and then we can easily do a follow-up study with you. What you want to know is that it's been published in the Journal of the American Podiatric Medical Association. It's been published again in the Journal of Diabetes Science and Technology. And again, we're not using this to diagnose a disease, because many people that are coming in here, they may not be coming for specifically peripheral neuropathy, but we're trying to say, hey, how is the overall nervous system working? How are your peripheral nerves working? Your peripheral nerves also go to your heart. They go to your stomach. They go to your kidneys. They go to your bowel. They run your thyroid. So we want to get an idea from this, how the entire peripheral nervous system is working. It was also published in current research on diabetes and obesity. And again, the only reason why we're saying diabetes is because a lot of diabetes patients have neuropathy and nerve damage. And then lastly, it was published in Disability Rehabilitation. So the test is quick and simple. We do 4 tests on each thumb and each large toe, and then from there we will be able to get a reading on what's going on with you. We'll tell you that you have severe nerve damage or all the way down to no normal nerve functioning. This is also part of our Super 7 testing, and it is an essential component at looking at the nervous system. Thank you. Hi, this is Dr. Fry. I want to go over with you the 7th part of the testing that we do that I call neuromyotomal evaluation. And basically what we're looking at is what indicators do we see when you're laying face down on the table that show us that there's imbalances going on with the brain musculoskeletal that we call neuromyotomal. And the first thing that we can do is we can
there's actually 14 of these. We evaluate 12 on a day-to-day basis. There's palpation. We come along with our hands and we feel. And we may feel and say, wow, you're carrying a lot of tension in the right side of your neck, the left low back, and your entire right leg is very, very tense. That's a sign of abnormal neuromyotomal firing. Number 2, functional leg length inequality. When we look at your leg length, the ideal state should be a little bit off. So we might find that if you have a weak left cerebellum, right cortex, normally what will show up there is the entire left side of your body is tight. And then what will that do? It'll pull up on your pelvis on the left-hand side. And when we look at your leg length, you have a functional leg length shortness on the left-hand side. We also can track how the legs change over time to see that what we're doing with our treatments are making a positive improvement or not. Abductor tendency and adductor resistance. This has a lot to do with when we push your legs in and out. Do we find that, again, the left outside of your leg is so tight that it pulls your leg out? That's called an adductor resistance. Foot flare, inversion, eversion. Are we noticing that your feet are turning in or turning out? When we lay you down and we're looking at your feet, we might notice that your right foot turns way under like this. Now, what is that? That's a sign of the brain neuromyotomal dysfunction. Heel tension, the Achilles, which is the back portion on the bottom of your foot, you might feel is pushing along there periodically. And what are we looking for there also? We're looking for abnormal heel tension. Wow, this side is much more stringy and tight than this side over here. Your calves, which is connected to the Achilles, are the major postural muscle. And if the brain is breaking down, many times we're going to find Achilles heel tension different from one side to the other. And again, if you're a left cerebellum, right cortex, it's usually dramatically different when we can push on the left Achilles versus the right Achilles. Abnormal breathing patterns. We may just look at your breathing. Your breathing is supposed to go from the top of your occiput, roll all the way down, hit you in the sacrum, and roll all the way back up. So if you have a trained person, which we all are, we've been doing this for a long time frame, we can look right away and say that's an abnormal breathing pattern. We may also tell you to just take a deep breath in. Again, looking for the normal roll of the breath. If that's off, that's another sign of neuromyotomal dysfunction. It's also a sign of dysautonomia. And 90% of the output of the brain goes to the autonomic. So if your breathing pattern is off, it's a sign that the brain is not working optimally. Inappropriate sustained patterns of paraspinal contractions. Again, this would be surface EMG testing that we are not doing. Congestive tissue tone. This is areas in the body where we can just feel congestion. There's a sense of swelling there. And many times we can feel it at various different areas. And again, it's an abnormal sign of neuromyotomal firing. Postural faults. When you stand, and we're watching you stand, do you carry your head very far forward? Does your head tilt to the side? When we lay you down, do we see a shoulder real high? Do we see a pelvis up a lot? Do we see that there's a lot more tension on your left side of your body, and the bottom portion of your leg is kind of extended up just a bit? Those are all signs of postural faults. Cervical syndrome test. We may push on your neck, have you turn your head left and right to see how the upper neck is working. Bilateral cervical syndrome test. We may have you turn right, turn left, turn right, turn left, and it would mean that both sides are off. And we can differentiate between one side being off, called the cervical syndrome, or bilateral cervical syndrome. Deerfield test is looking at mainly the pelvic area. And we can test that by looking at your leg length when you're laying face down and then flexing your legs up. If one of the legs, the short leg on the left-hand side, let's just say, when we lift it up, crosses over to now become a long leg, when we bend your legs up, that's a positive Deerfield test. And then lastly is abnormal heat energy radiation from the body, and there's various devices to check that as well. So these 14 indicators, of which 12 we look at on a day-to-day basis, are insightful ways of us looking at how is the tone of this person's nervous system. Do they have good neuromyotomal tone, which good tone is like Mozart and bad tone is like rap music. If there's good tone, we're going to see a lot less of these indicators, and these indicators will change and clear out quickly as you're getting treated. So this is the last part of your evaluation. It's very insightful. These indicators were collected by Dr. Holder. He sat down with the top 6 or 7 tonal techniques and ask them, how do you know if there's abnormal tone inside this person's nervous system, and how would you document that? And by sitting with these people that either developed the technique or invented the technique, he came to the conclusion that these were the most reliable indicators of neuromyotomal tone. Thank you. Have a great day. Hi, this is Dr. Farley, and what I want to go over with you in this video is about our affiliation with Cambridge Brain Sciences. This is cognitive neuroscience brain testing. There's between 6 and 12 tests that can be run. We're calling these 12 tests the Dirty Dozen, so that it's an easy way to remember it. We do the Super 7 testing, and this is now a new product that we brought in here to really be able to go deep into cognitive neuroscience brain testing. A little bit of information on this Cambridge brain testing. There's specific brain regions that have been linked with performance on each of the Cambridge brain science tests. The information comes from studying how performance on the test is affected by factors such as injuries, disease, epigenetic imbalances, as well as studying healthy brains. Using functional MRIs and positron emission topography, which are called PET scans. So basically what we can do is, what they've done is we measure the brain with those technologies, the functional MRI or the PET scan. We have you do the test, and then we know which networks inside the brain are actually firing. And then we can also use the test as a scientific validation of our treatment, the neuro-biomedicine plans that we've set up here, and also track you over time. A little bit about the Cambridge Brain Sciences. They were developed in a laboratory by Dr. Adrian Owen from Canada, excellent research. He was the chair in cognitive neuroscience and imaging. And over the course of a 25-year career, he's developed these. The tests assess aspects of cognition, including reasoning, memory, attention, and verbal ability, behavior. There's over 300 scientific studies that have been run to date using the CBS tests, yielding more numerous publications in leading academic journals than any other testing in the world. Some of the testing has been published in a couple main journals that I want to go over with you. There was a study published in the Journal of Neuron on almost 45,000 people took the Cambridge Brain Science testing, leading to an important discovery. It was that intelligence is not just one thing. There are at least 3 independent intellectual domains, and again, we can now measure it with Cambridge brain testing. There was also another study published in the Journal of Nature that basically looked at cognition and your overall energy levels. There's many other testing that was done in Frontiers in Psychology Journal, the Journal of Neuroscience, the Journal of Geriatric Psychiatry, the Journal of Healthcare Engineering, the Journal of Medicine and Sciences in Sports and Exercise, the Canadian Journal of Diabetes, Experimental Gerontology. I'm going to review a few more here with you. Neuropsychological Journal, a Sleep Journal, Dementia and Geriatric Cognitive Disorders, the American Journal of Health Promotion, the Journal of Neurology, Neurosurgery, and Psychiatry. So the point being is that there's over 300 publications that have used this exact testing that we are now affiliated with in the office here, and we're going to be providing these, what I'm calling again the Dirty Dozen testing on our patients. So the testing can take usually about 45 minutes to an hour. Sometimes we may split it up. Sometimes we may only do a few of the tests if that's necessary, and sometimes we'll run the entire battery. The testing, again, is going to be another way to document where your current brain function is, and whether you're coming in as a thyroid patient and you're concerned about the brain, you're coming in as a chronic pain patient, you should be concerned about the brain, an autoimmune patient, you should be concerned about your brain, dementia, Alzheimer's, you should be concerned about your brain, Parkinson's, and even other issues like rheumatoid arthritis, depression, anxiety, bipolar, schizophrenia. We can now have a much deeper aspect of taking a look at what's going on with the brain, understanding the exact brain regions, and then tracking you over time. It's also likely that over time we're going to publish this into a research project, and your testing, if you decide to add this testing into your examination, your testing will be part of that research study. And we're going to probably compile that over a 2 or 3 year, maybe 2 to 5 year time frame, and then be able to publish this data so we can document and show what's changed inside the brain, and also how neurobiomedicine has a profound impact at raising your level of brain function, which raises your overall health and wellness in multiple different ways. So thank you, and have a great day. Hi, this is Dr. Farley. So you just saw the pre-consultation video explaining briefly the Neuro-biomedicine Health Systems Program, and you just saw our Super 7 examination process. And you and I are going to be meeting in a few minutes to decide whether we're going to be moving on to do the Super 7 examination process or not. And I look forward to chatting, and we'll have a real good conversation about what's been going on with you. I'll listen to what's been going on with you, and I'll give you my honest insight as to whether you should move on to the Step 2 Super 7 examination or not. Thank you. Hi, this is Dr. Farley, and in this video I'm going to be going over a new piece of equipment that has 3 different test measurements. This is one of the most recent things that we've brought in. The technology has been around for at least 30 years, and I just decided to invest in it and incorporate this into advancing my Super 7 Plus testing. Again, all testing that we do here is to assess a person's allostatic stress load, and then from there figure out what we can do to modify it, change it, so that a person can have a higher level of healing. Healing means to reduce the allostatic stress load and allow your cells that constantly turn over to produce a better quality cell and a better quality cell. So when we start to get breakdown, cells cannot turn over and reproduce properly, then we finally get symptoms after there's 85% damage. So this testing will go deeper into looking at a person's allostatic stress load. So part of this is looking at an autonomic nervous system test called NeuroPulse. It's a separate heart rate variability testing, and through that we can either do it on someone's earlobe or a handheld device. We can get a lot of valuable information, and again, this is part of our baseline testing. We can go back again, and we're looking to see positive shifts. The second part of it is called NeuroCore. It's called surface electromyography. Basically what we're picking up with this is muscles. So the muscles, your posture, and your muscle tone is determined by the brain. So this has a lot to do with how the brain is working. It tells us a lot to do about the stress response, your allostatic stress load, and we can begin with the patterns and then over time go back and recheck again to see how the patterns are changing based on where your initial starting point was. And then the last one is a neurothermal. Again, this is looking at thermal scanning becomes a major interpretation of patterns and lets us see how you may have chronic subluxation patterns, and also can look at many chronic things within the nervous system, again looking at allostatic load. And this can actually change pretty rapidly, almost day to day, hour to hour, but it's still a good measurement to kind of baseline. And sometimes I will use it on a day-to-day basis to look at pre-treatment, post-treatment. But again, it's looking, it's another assessment of your allostatic stress load. So if you have any questions, please let us know, and these tests will be performed on you as part of our process to determine your allostatic stress load. And again, what we're all into here is looking at normal anatomy, normal physiology, normal biochemistry, measuring a person's allostatic stress load, influencing the system in the right direction, to then allow those cells to turn over properly and increasing a person's healability. Thank you very much, and if you have any questions, please let us know.